Hello everyone, today we will be talking about acute otitis media. In this video I will be covering causes of acute otitis media, clinical picture according to the stages of acute otitis media, and finally we will be discussing about its treatment. So let's start it. First of all, let me clear the term otitis media for you. In the Greek language, otos means ear and tis means inflammation. So otitis is inflammation of ear, and the term media means something in between. So as a whole, otitis media means inflammation of some middle part of the ear. That middle part is middle ear cleft. Actually, the inflammation lies in the mucosa of the middle ear cleft. This middle ear cleft consists of the middle ear cavity and the mastoid air cells. Actually, this inflammation is caused by bacteria. The most common bacteria are Strep pneumoniae, Haemophilus influenza, Morazella catarrhalis. These bacteria somehow reach the middle ear and then they cause the inflammation in the mucosa. The most common pathway is through the Eustachian tube. If there is infection near to the Eustachian tube, then this infection can extend through the Eustachian tube to the middle ear. For example, if there is infection in the nose, as in case of rhinitis, or if there is infection in the sinuses in case of sinusitis, or if there is infection in the pharynx in case of pharyngitis, tonsillitis, or adenoids in the children, then these infection can reach to the Eustachian tube and through which this infection can extend to the middle ear mucosa. Secondly, sometimes infected material can pass through the Eustachian tube to the middle ear mucosa. For example, vomitus, milk or the water. They can take bacteria along with them and this bacteria can cause infection in the middle ear. So Eustachian tube is the most common passage through which the infection or the bacteria can reach the middle ear and cause the inflammation there. There is second route through which the bacteria can reach the middle ear, which is through the external auditory canal. This will occur only if the drum is perforated. In case of intact drum, bacteria cannot pass from acoustic canal to middle ear. And the third way is the blood. If there is bacteremia, which means bacteria in the blood, then through the blood the bacteria can reach to the middle ear mucosa and cause the infection there. Once the bacteria reaches there, the process of inflammation will start, and this process of inflammation is categorized into the 5 stages according to the pathological changes occurring in the ear. The first stage is the tubal catarrh. In this stage, the bacteria is limited to the Eustachian tube only, where it produces inflammation, causing edema and congestion of the Eustachian tube that results in the obstruction of Eustachian tube. The air inside the middle ear cavity is absorbed. Eustachian tube cannot open and provide the air to equalize the pressure. So there is negative pressure in the middle ear cavity that causes retraction of the eardrum. This is the picture of the healthy eardrum. The color of healthy drum is light gray and we can see clear cone of light in the healthy drum. The second picture here is the retracted eardrum. Here the color is light gray, which is normal. Here we can see prominent lateral process of malleus, and secondly we can see anterior and posterior malleolar fold very obviously, and the cone of light is also disturbed. So these are the signs seen through the otoscopic examination. If we perform tuning fork test, then we will see conducting hearing loss. In this person, the bone conduction is better than the air conduction. In this stage, the drum is retracted, so the movement of the drum is not free as before. So that will create problem in the conduction of sound. That's why the person will suffer from deafness. So at this stage, the symptom is only deafness. Now let's come to the second stage, which is known as catarrhal otitis media. In this stage, the inflammation has already reached to the middle ear mucosa. So in this stage, the blood vessels of the middle ear mucosa are dilated and are leaky, and they produce serous exudate in the cavity of the middle ear. So if we see through the otoscope, then we will see redness or the congestion in the eardrum. So these are the signs through the otoscopy. If we perform tuning fork test, then we will see conducting hearing loss. At this stage, there is problem in the tympanic membrane. That's why he will be suffering from the deafness or the decreased hearing. As well as there will be another additional symptom that he will have ear pain. Now let's come to the third stage, which is known as suppurative otitis media, and this stage is characterized by the pus formation. If we see from the otoscope, then we will see the eardrum is bulged and congested. In this picture we can see a clear bulging. This is the malleolus, and this surrounding tympanic membrane is coming above the plane of malleolus. And again through the tuning fork test we will see conducting hearing loss. As in the previous stages, there will be deafness and the pain, but the nature of pain is throbbing because of the pus. Along with the deafness and the throbbing pain, there will be characteristic symptom which is fever. It is because of the suppurative inflammation. Now let's come to the fourth stage, which is the stage of perforation. As we discussed in the previous suppurative stage, there was pus inside the middle ear cavity, which will cause necrosis of the drum, which will finally perforate and the discharge will come out of it. In this picture we can see the clear perforation, and yellowish this pus is coming out. This perforation is usually in the anterio-inferior region. So through the otoscope what we can see is the perforation and the discharge. Again through the tuning fork test we will find conducting hearing loss. In this stage again there is a problem in the tympanic membrane, so he will be suffering from the deafness and he will complain of some discharge from the ear, but other symptoms in the previous stages like pain and the fever will be decreased. As the pus is drained out through the perforation, the tension over the nerve endings of the middle ear mucosa is decreased. That will result in the decreased pain. And finally, the fifth stage is the stage of recovery. In this stage, there will be healing of the drum and the other pathological changes that occurred in the ear. So after studying all these stages and their clinical picture, we came to know that acute otitis media is infection in the middle ear cleft, which is middle ear and mastoid ear cells, which results in the decreased hearing, ear pain, and fever. And finally, eardrum perforates and discharge comes out of it, and person may also complain of discharge. So we came to the treatment of the acute otitis media. Acute otitis media is treated by the systemic antibiotic for 10 to 14 days. We usually start with the penicillin or the augmentin. And for the symptomatic treatment of the pain and the fever, we give analgesic and antipyretics. These are the general line of the treatment. But we will also give local treatment according to the stage of the inflammation. In the first stage, which is known as tubal catarrh stage, there is congestion and the edema of Eustachian tube that lead to the obstruction, so we will try to give some decongestant drops. We will put these drops through the nose, that's why we call them decongestant nasal drops. If we put from nose, then it will reach to the Eustachian tube and it will work there. And the commonly used decongestant drug is the xylometazoline. In the catarrhal stage of otitis media, we will try to give warm glycerin phenol ear drops. Glycerin is hygroscopic, that's why it will try to decrease the exudate from passing into the middle ear cavity. In the third stage, which is known as the suppurative otitis media, we will give antibiotics and we will wait for the 48 hours. After taking the antibiotic for 48 hours, if there is no decrease in pain or fever, then we have to perform the myringotomy, which will drain out the pus, and this pus must be sucked out and the local antibiotic eardrop must be given. The reason behind performing myringotomy is to make a clear incision to drain out the pus, because the regular incision heals better than the irregular perforation, which is made by necrosis of the drum after the suppurative stage. So in the fourth stage, which is the stage of perforation, we will try to suck out the pus and put antibiotic ear drops. In case the perforation is high and the pus cannot be drained out nicely, in that case we will perform myringotomy in the lower position so that pus can be drained out easily. So if the person gets adequate journal and local treatment, or if he has good immunity, acute otitis media will resolve completely. On another hand, if treatment is inadequate or if he has bad immunity, then there might be chances of complication, or the condition may become chronic, which we call as chronic otitis media. As far we have discussed about the causes of otitis media, its 5 stages, and sign and symptoms of each stages, and finally we have discussed about the treatment, both journal as well as local. Now before finishing the topic acute otitis media, I would like to cover one very important point, that acute otitis media is very common among the children, and the common source of this bacteria for the acute otitis media is the adenoid, followed by common cold or the upper respiratory tract infections. The shorter, wider and more horizontal Eustachian tube is one of the predisposing factor in the children for the otitis media, because in such kind of Eustachian tube there is more probability for the infected material to enter inside the middle ear mucosa through the Eustachian tube. After getting the infection in the middle ear, children will produce different kind of symptoms than in the adult, as we discussed before. Because children will not say, "Oh, I have pain in my ear. Oh, I am hearing less nowadays." They will just cry because of the pain. They will just pull their ear because they will feel something is irritating in their ear. And they will be febrile, they will have fever, and sometimes they get vomiting and diarrhea because the pus from the middle ear comes out through the Eustachian tube into the GIT. That will irritate the GIT, causing vomiting and the diarrhea. If we observe the ear of these children through the otoscope, then we will find congested eardrum and the cone of light will be absent. The tympanic membrane usually resists bulging and rarely perforates. This happens so because of its thickness. So in case of the children, the tympanic membrane rarely perforates. That's why usually there is retention of the pus inside the middle ear. This pus may spread to the inner part of the ear or inside the cranium, creating some complication. That's why children having otitis media is more liable to complication as compared to the adult. The low immunity of the children will also support for the complication. So through this discussion we knew that acute otitis media is infection in the middle ear cleft, which is middle ear and mastoid ear cells, which results in the decreased hearing, ear pain and fever. And finally eardrum perforates and discharge comes out of it, which can be treated successfully with the adequate treatment. And in case of the children this is very common because of the anatomy of the Eustachian tube, and the most common source of infection is the adenoid. And in case of the children the symptoms will differ from those of the adult, as the baby cannot say I have deafness or I have ear pain. He will be just crying and pulling his ear. And finally we knew that children are more liable of complication because of the pus retention and the low immunity in the children. Okay, that's all about the acute otitis media. If you like the video, please give it a thumbs up and please do subscribe my channel and hit the bell icon as well, so that you will be informed as soon as I upload my new video.